The article I would like to review is from correspondent Sarah Sidner of CNN News. The article outlines the serious dilemma of fentanyl abuse plaguing California and other states. In her article, Fentanyl, the Powerful Opiate That Killed Prince, Sidner describes how this powerful opiate was the cause of the singer Prince's death by accidental overdose. But in addition, fentanyl has been linked to a high number of accidental overdoses in pockets of Sacramento, California, Ohio, Florida, and New Hampshire. Ms. Sidner explains fentanyl is 100 times more potent than morphine and 50 times stronger than heroin. The most serious issues are many drug abusers are purchasing opioids laced with fentanyl. DEA agents have been tracking how fentanyl was being processed to look like other opioid painkillers such as oxycodone, heroin, and morphine. Lawmakers are attempting to implement policies to penalize those involved with manufacturing and trafficking illegal laced drugs and pills. The organization DOPE, in order to address the epidemic, trained 6,000 people to administer Narcan, a nasal spray or injection to counteract the effects of overdose. The current policy in Alabama, Governor Kay Ivey on August 8th of 2017 signed an executive order number 708. This established the Alabama Opioid Overdose and Addiction Council. The council was created by Governor Kay Ivey and tasked with developing an action plan that establishes recommendations for policy and regulations to address the overdose crisis in Alabama. This action plan, the council should develop and submit a plan to the governor that establishes recommendations for policies, regulatory actions to address the overdose crisis in Alabama. This plan shall include clear goals, objectives, merits for measuring progress in combating the addiction and overdose crisis and reducing opioids overdose deaths in Alabama. The plan may include some recommendations as A. Imposing surveillance opioids misuse, addiction, and overdose. B. Expanding access to appropriate prevention, treatment, and recovery support services for opioid disorder. C. Improving access to Narcan. D. Increasing awareness of the overdose epidemic. E. Reducing the stigma associated with substance use disorder. F. Improving prevention education for all Alabamians. G. Enhancing the prescription drug monitoring program. H. Promoting evidence-based guidelines for pain management. And I. Improving coordination and collaboration among relevant stakeholders. Some of the strengths for this policy is improving access to treatments and recovery services, promoting use of overdose reversing drugs, strengthening our understanding of the epidemic through public health surveillances, providing support for cutting-edge research on pain and management addiction, advancing better practices for pain management. Some of the weaknesses are aggressive and misleading marketing campaigns that mislead the widespread prescribing of opioids by doctors and hospitals. It's also clear that policy decisions and failures have played a role, especially drugs with high potential for addiction and abuse. stronger oversight governing clinical use versus real-world use. Also, the Department of Public Health receives funding from the Center of Disease Control, data-driven prevention incentives, and opioids and heroin abuse and overdosing to address this crisis in Alabama. The ADPH is leveraging existing partnerships among healthcare, public safety, education, and treatment programs, the state and local government to facilitate and development of statewide prescription drug and heroin prevention plans. How can social workers promote these changes? According to the NASW, they would like to make these suggestions. They recommend that the national, state, and local public entities continue approach the opioid and heroin epidemic from a public health perspective, which includes awareness of the issues, development of prevention, comprehensive treatment options, and policy changes. Being an essential component of the public health community, the NASW strongly recommends that harm reduction programs include syringe exchanges be included in the guidelines for treatment interventions. In order to effectively reduce substance use and reduce the health consequences, they recommend that the international bodies include the UN of Office on Drug and Crime and the World Health Organization also include harm reduction as an international policy objective. Other facets include to promote the responsible use of opioids, to reduce the supply of opioids, and also to support overdose prevention and expansion access to Narcan. Have a great spring break.